for people suffering from hypertension. You're going to be getting into details on the same with Lispa and Dr. Mary from Udaya Level 4. I'll start with you, Dr. using that camera. Kindly say hi to our viewers and also tell us where you work.
Hello viewers, thank you for joining us for this talk today. My name is Dr. Mary Ndericho. I'm a physician based at the Udaya Sub-County Hospital, and I'm glad to be here.
Thank you so much. We're also happy to have you. And on my right is Lispa. Can you take a moment? Talk to our viewers more, although you are a familiar face.
Yeah, I've become a familiar face now.
Yes.
So good evening, our viewers. I'm Lispa Mudhoni. I'm a health promotion officer. I'm the Sub-County Health Promotion Officer here at Udaya. Yeah.
Thank you so much for making time for us. Now, someone might even be wondering, when you talk about hypertension, just what is it, Dr.
Hypertension refers to a disease where blood is passing through your blood vessels at higher than normal pressure. So it's hypertension, higher than normal pressure. And so we classically diagnose it when your blood pressure is measured using a good machine and using a good technique, and it's found to be in Kenya above 140/90. And usually we will require that it is done several times, maybe 2 to 3 times at different sittings to confirm that it is actually elevated, unless in a situation where maybe now it's too high, it's above 180/110, which you call grade 3 hypertension. In that case, we might not require 3 repeated readings to make a diagnosis. But classically, pressure more than 140/90, 3 separate readings makes a diagnosis of hypertension.
Thank you so much. And in central Kenya, we are really quite affected by hypertension. The numbers are really wanting. Maybe could you touch a little on the statistics? How maybe paint a scenario for our viewers. How badly are we affected by hypertension in central region?
So hypertension is it's an epidemic. I'll start with statistics maybe for the country and say that one of the most comprehensive surveys that was done was in 2015, the STEPS survey. And from that survey, 25% of the participants, so a quarter of the people who were involved in the survey were hypertensive. So we are talking about adults more than 18 years. Of those 25% who were found to be hypertensive, only 15% knew that they were hypertensive. And of those 15% who knew they were hypertensive, only 8 to 10% were on any form of treatment. Of those 10% who were on any form of treatment, only about 5% were well controlled. So those are very grim statistics that many people don't know they're hypertensive. The ones who do know they're hypertensive are not on treatment, and the ones who are on treatment, majority of them are not being controlled. And what does control mean? You're taking medication and you have a good blood pressure. And in terms of control, we actually use 130/80 as the good blood pressure. Of course, sometimes it varies a little based on someone's age and other risk factors, but generally speaking, 130/80, if you are on treatment, should be what we are aiming for. And that's the message that individual patients should carry with them, that you're not out of the woods if you're taking medicine and you're not controlled. And that does not take away from the other large percentage of people who do not know they're hypertensive, and so they're not seeking the services.
Thank you so much for that, Dr. Now, Madam Lisa, what could be the cause? What are the risk factors? What increases one's chances of suffering from hypertension?
Okay. Flashing back, we can say that hypertension is a non-communicable disease, and non-communicable diseases, we term them as lifestyle diseases. So the lifestyle that we live, the kind of life the kind of health behaviors that we adopt is what will determine if you'll have pressure or not. Although some cases we have, like the first risk factor is the family history. If maybe you have a family history of somebody in your bloodline had pressure, you are at risk. Not necessarily that it is a must, everybody in that family line will have hypertension, but you are at risk. So the other factor is the fact that the people who consume a lot of salt. Salt has sodium, and sodium will works as a fluid retention in the body. So with a lot of fluid retention in the body, it might result in high blood pressure. So that those people who took the nyama choma, the raw salt, so it's good that we reduce we just check the amount of salt somebody is consuming. The other risk factor is the consumption of tobacco, which can be through the cigarettes. Some people just take the tobacco itself, maybe in Kikuyu we say mudhogotos, they just do the tobacco. So when you have tobacco, when you just consume tobacco, it temporarily increases the levels of your blood pressure. The way we say you feel high. So that highness, it somehow temporarily increases your blood pressure. So with time, you are at risk of having the blood pressure. Also, there is also the pressure that is resulted as, maybe as the doctor has said, it is the pressure in our arteries, our veins, the blood vessels. So if at all maybe the blood vessels are narrowed because of maybe you have some fats in the blood vessels, you'll find that now the blood vessels have become narrow and the blood is trying to stretch through the blood vessels. So as a result, you have blood pressure. So that the risk factor is having a lot of, maybe we can term it as obesity, because obesity is also a risk factor, and that's why it's good. The way people go to the hospitals to just take your kilos, it's good also take your make sure you see a nutritionist, so you'll be able to get the correct BMI, so that now the nutritionist will tell you if your kilos are good or your kilos are not good. Because most of the time when we go to the facility, we tend just to know our kilos. We don't want to know now the BMI. So I would urge our viewers, as we go to the facility, don't just get to know your kilos. Try and know about the BMI itself, and like the normal, the way we go and search for our kilos. So another risk factor is alcohol consumption. So I would also say let us drink responsibly. Yeah, those are the major risk factors that may pro us to have hypertension.
Thank you so much. And from what I'm gathering, all those are things we can almost prevent. Sure. But then we're going to get to that. Now, there has been a close relationship between hypertension and a few other conditions like diabetes. How does that come about, Dr.?
So diabetes, just from the definition of it, is just basically high blood sugar, and we can discuss another day about the types and how we go about that. So usually in diabetes, the problem is that you're not controlling your sugars, and as a consequence of that, you're having your organs being damaged. Now, how hypertension and diabetes become linked is not in their causation, is both in their causation and in their complications. So they are caused by the same problems, which are the risk factors. The risk factors between the two are quite interlinked. So we have both of them being lifestyle diseases. We have both of them being linked to obesity, alcohol use, smoking, sedentary lifestyles, and low physical activity, and bad diets. And as a consequence, when you have two of them, then you have double jeopardy, and you're at even a higher risk of developing the cardiovascular diseases. So I'd say they're linked in two ways, in that their risk factors are quite similar, and also in that their complications are the same, cardiovascular diseases. And they also occur, for example, in urban and peri-urban areas. They are more likely to occur together, so they affect the same populations basically.
And what are some of these cardiovascular diseases that you've mentioned? So
just so our viewers do not find it as a hard word, it just means cardiovascular disease. So cardio, these are diseases that are affecting both the heart and the blood vessels. So usually how they are affected is by the damage to the lining of the blood vessels, and then you have the blood vessels becoming thickened, and so the space where the blood is supposed to pass becomes smaller than it should be. And eventually, as the disease progresses, then you end up with the vessel actually being occluded or blocked. So this will occur with hypertension and diabetes, and as a result of the risk factors we've talked about. So if it occurs in your brain, it ends up being a stroke. if the occlusion occurs in the heart, that ends up being a heart attack. It occurs in the blood vessels of the legs, then you can have something called peripheral artery disease. It can occur in the kidneys, then you end up with kidney failure. So because they are cardiovascular diseases, the vasculature is everywhere, so they can affect all organs, but they affect the ones we've talked about majorly because those are main and critical organs, and when they're affected, then the health of the person is in actual jeopardy.
Now, Lispa, Daktari happened to mention that we have people who are aware they have hypertension and they're not even taking their medication.
Sure.
What could be leading to that? Is it that our people are stigmatized? They fear that someone will know that they have hypertension? Is it that the medication is not available? Is it that they lack awareness? Why? What is leading to that?
All those things, we can start by denial. And also maybe the message packaging, maybe in our health facilities. Although the doctors do their best, you are told you have this condition, it's a lifetime condition, but now that processing, you know, when you are told, like, if you hear somebody is told you have cancer, they see death. So with the blood pressure and the diabetes, they also see like it's something complicated, because one thing we say, change is a process. I was used to taking maybe alcohol, the health, those lifestyle, the lavish lifestyles. Now you have told me I don't have to take my nyamachoma. Now I have to take medicines. I have to drop some. So there is that kind of denial, and now to adaptability to that change. It takes quite some time, and what I would urge people is just accept, because the minute you accept, the other things will flow. You'll be able to take the correct diet, you'll be able to take the correct medicine, the correct timelines, because there is also an aspect of timelines. You might be taking the medicines, but you're not taking them at the right time. If it is 2 times a day, I always urge, if it is 9 a.m. in the morning, 9 a.m. in the evening. So one factor is about denial. The other one, once I have denied I have hypertension, I might not even tell the other people, my family members. So unapata, like even like HIV, people hide. So the minute you don't accept yourself, and it is also something, a societal problem also, because now the minute I say I have hypertension, so everybody in the community will also, the community also lead us, maybe the patients, to have that denial, because you will also be stigmatized at the community level. So it's something individual, and also I would urge even the community members, please, not even fall from the community. Let us start from at the family level, because even you see, for example, you will see in the issues of control, like the Daktari has said, you might find that Ashosho is like 90 years old, so she even doesn't know at the timelines of the medications, when the medications are there or when they are not. So even the family members, they have also left behind the elderly. You find that they don't have caretakers. Somebody is coming to the clinic, she is 80 years old, she doesn't understand even what the doctor is telling her. So it's all about denial, support from family members, and also sometimes the economic status, because you might find that if somebody is diabetic and he or she uses insulin, the insulin at the chemist it's very expensive. But now the people are not even using something like NHIF, because with an NHIF card you can go to their level 4, you'll be given the prescription, and you'll be able to have access to that insulin. But now, since you don't have NHIF card, you are supposed to buy it maybe from the chemist, and that the chemist, maybe it's from around 600. Now imagine telling a Shosho who lives alone to buy that insulin. Will she buy? No. So it's all about the denial. It's all about support even from the family members, and maybe at the entire community level. So that, and also now the economic status, and that's why I would urge people, if you have your mother at home, sisi tuko Nairobi, you are living life, that's what I would say. Let us get back to our grannies, our mothers, make sure they have an insurance package for their health, make sure they go for clinics, because those grannies, they don't even know maybe the dates for the clinic. So you will find that they'll find themselves with the cardiovascular diseases because they don't even have the follow-up. Yeah.
Thank you so much. And it is right to call this an epidemic because we even have people that do not even know how to go about it. And so we really need to stand together if we are going to fight this. Now, Dr. coming back to you, you also happened to mention that there are some people who don't even know that they are hypertensive, yet they are. What are some of the signs and symptoms that if our viewer sees these or notices these signs and symptoms in their body, they should rush to the hospital?
All right, if you would allow me, I'd also like to, that previous question,
It's okay.
It really affects us as healthcare workers. And she's brought up many of the issues that we deal with, especially with the elderly, not knowing their medication, how to take them, when to take them, mixing them, and getting side effects or getting very low blood pressures. So that is a pertinent issue. The other issue I'd like to bring about why people are not taking medicine is because everyone keeps saying that mwili yangu itazoea dawa. But I'd want for our viewers to realize the reason why you take hypertension medication, you might not be feeling anything, which is what we'll talk about, the symptoms, but we are preventing cardiovascular diseases. So when your blood pressure is, you go to your health facility, you're taking medicine and you're told your blood pressure is okay, that means you keep taking the medicine at the dosage you are taking, not you stop because the pressure is okay. So the other, so where we give you the medicine is because we want to prevent the cardiovascular diseases. And as preventing the cardiovascular diseases outweighs whatever side effects you might have. But if you have side effects to medication you've been given to in a hospital, you come back and the medication is changed. We have so many classes of medication for hypertension. So if one is not working for you, we change to another one that works for you. So we do not want you to be in any discomfort just because you're taking medicine. And we really do not advise you to just stop because you felt bad. Stop. Some of them are quite serious side effects. You'll find someone coughing for no reason for months on end because they are given a certain type of medication. Not because it's bad, but because some people develop cough on that medication. You just bring it back and we change it. Then it's important that they keep following up their clinics. So it's good to take your medicine at home, but it's also important that you come to the clinics. Why? Because every so often, usually once a year, we have to check whether your kidneys are working properly, whether your heart is okay, whether your cholesterol is okay, whether you have now a new diagnosis of high blood sugar. So it's important even when you're taking medication to be seen in a facility and to be seen regularly. If the cost is an issue, discuss with your healthcare provider. There are cheaper alternatives for most of the medication. Sometimes we've given you 2 of them, one of them is becoming a problem to acquire, then we can increase the dose maybe of the other one that is easier to acquire. So it's important to have those discussions that are barriers to you taking your medication and to have them frequently with your healthcare providers. Remember again, the other issue is that hypertension management and basically management of any medical condition is very individualized. So your hypertension may be well controlled with one medicine. There is another person in your village or your church who requires 5 medicines. Do not compare. Do not say, me when I go, I'm given just this one and pressure is perfect. So maybe I need to remove all these 5 and take the one you're taking. Maybe that's the problem. We are all very different. We respond very differently to medication. Some people are very sensitive and a small dose just controls the blood pressure. Others will require several that are taken even 3 times a day. We try to make sure at the end of the day we use the smallest dose that is able to give you the normal blood pressure, but sometimes that becomes a challenge and you have to be on several medications. So it's important again that we don't compare. Management of most diseases is individualized. I'll come back to the question that you've asked me about the signs and symptoms of hypertension. So high blood pressure, there are no classic symptoms that we'll hear and say these are the symptoms of high blood pressure. In fact, high blood pressure has been described as a silent killer because you'll have no symptoms for the longest time. In fact, when you start developing symptoms, it's most likely that your pressure is now becoming too high and you're developing complications. That being said, some of the symptoms that people describe include a headache, and usually they say the headache is at the back. They feel like something is pulling, like at the back of the neck. The other thing is blurring of vision, where you are seeing properly but now you're not seeing very well, and sometimes that comes together with the headache. The other thing that usually present with nosebleeds you come and your nose bleeding and it's difficult to control. It's happened several times and your blood pressure is high. So then there could be other symptoms that point us to complications. For example, you're getting weakness of one side of the body that comes and goes. Sometimes it's there, sometimes it's not. You could be having shortness of breath. You could be having pain on your chest, especially just behind this bone right here, the sternum, or towards the left side. All those are symptoms that can occur with hypertension, and usually they signal that your pressure is getting too high and you need to seek help.
Thank you so much for that piece of information. Now, I think we've mostly even discussed about treatment and management of the same. But just to get it clear, does it mean that once you are diagnosed as hypertensive, you're gonna have to do with medications for lifetime?
That is a general statement. As a general statement, that is true. Hypertension is a lifelong condition for which you're going to take medication for at least the rest of your life. The medication might change, the dosages, the kinds might change, but usually you take them for the rest of your life. There are circumstances that can occur that cause you to not take medication for a long time, but these are very few and far between. So again, we don't want our patients to compare. For example, if someone develops an issue with the heart, like a heart attack or a heart failure, there are some that come with low blood pressure. So that is actually a complication of hypertension where you actually need less medication. There is a small subset of patients who have something we call secondary hypertension. So about maybe 10% maximum of patients, and I'd say I've seen very few who have secondary hypertension, where the hypertension has a specific cause, a cause that can be corrected and the hypertension corrected. Very few, and those ones are younger patients, so they're in their 20s, in their 30s with very high BP, and then we check their kidneys. There's a problem with one of the renal arteries, which is one of the blood vessels to the kidney. There's a problem with the adrenal gland. There's a problem with one of the vessels coming from the heart, and those ones, then that can be corrected and the hypertension are corrected. But again, that's only 10% of hypertension. Largely, hypertension is a chronic condition for which you need to be on management for lifelong.
Thank you so much. Now I want to take a quick break, and when we come back, we're going to talk about prevention and what the government is doing about the whole situation of hypertension, what interventions are there. But remember that GTN TV, your favorite TV station, has been nominated for the TV of the Year Awards, and we are really asking you to vote for us by going to www.kuzaawards.co.ke and cast your vote there. Alternatively, you can send the word Kuza to 15601 to help us bring the award home. Don't go away, we are going to be back shortly.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. O nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahich Hotel, Murang'a Town, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Robogo Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakima Modern House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 07258641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku. Kuza Awards 2024 ĩrĩ haha na ithuĩ na GTN TV nĩ ĩcagũrĩtwo gĩkĩro-inĩ kĩa TV yaku nĩyo People's Choice Award. Ta ceceni yaku nĩguo ũikia kura yaku, andĩka ndũmĩrĩri nguhĩ ũkĩandĩka kiugo Kuza ũtũme kũrĩ 15601 kana ũikie kura yaku kũgerera rũrenda nĩ rwa www.kuzaawards.co.ke. na wĩkĩrie kura Grassroots Television Network. O rĩngĩ ceceni ya GTN TV gwakinya nĩ gũcagũra ũkwandĩka Grassroots Television Network. Gũikia kura gũtirĩ na marĩhi. GTN TV mũciĩ wa ihenya taranda.
Thank you so much for keeping it GTN TV. My name is Mumbi Mavuti and this is the Medicamp Health Show. And today we are talking about hypertension, something Dr. Medi has termed a silent epidemic. Now, let's talk about, we hear that there is a relationship between hypertension. It is going to affect your eyes. At some point, someone could even lose their sight. How does that come about before now we proceed to treatment?
All right, how hypertension causes you to lose your sight or to have poor sight is because it causes cardiovascular disease. So you have your blood vessels in your eyes, and with the blood passing through the vessels at a very high pressure, it damages the lining of the blood vessels, which you call the endothelium. The endothelium, like the rest of the body, tries to heal. By healing, it deposits a lot of connective tissue there. So you have a narrow blood vessel becomes even narrower, and as more blood continues to pass with a lot of pressure, then there's a risk of the area that was healing developing a rupture and eventually blood clotting over there. So what you end up with is a clotted, a blocked blood vessel. So beyond that, blood is not able to get there, then you develop an infarct. But the other thing that happens, especially in hypertension, if the blood pressure is very high, is that the small blood vessels of the eye rupture, and then you develop hemorrhages. And usually this is what the eye doctors are able to see when they look into your eye, not just the top of your eye but the back of your eye. So something we call retinal hemorrhages and retinal exudates, which is just fluid is leaking into the surface of the retina, which is where images are processed in your eye, and also blood is leaking there. So when they see, they can see a lot of blood, a lot of fluid leaking there, and that goes through stages. So it progresses as your blood pressure becomes higher and becomes more uncontrolled. The same process is happening in many other parts of the body where the blood vessels are.
Thank you so much. But if we embrace treatment and medication, it does not have to get there.
True. When your blood pressure is well controlled, even when you're in medication, then your risk for developing these complications are minimal. They are just like the risk of someone who is not hypertensive. So then your risk comes down, and then you can just go for an eye checkup every year just to make sure everything is okay, but you rest assured that your eyes are not getting damaged as you go.
So if maybe you could break it down for us, what exactly does treatment entail? Of course, you said that it is very personalized for almost every other patient, but what exactly does most of it entail?
So in management of these, we'll say non-communicable diseases, and even more specifically cardiovascular diseases, management is twofold. There is management of the lifestyle and management using medication. So none of them is superior to the other, I'd say. So in terms of lifestyle management, it is not casual advice. It is very specific advice that patients really need to follow. For example, we are talking about treatment of a patient who's already hypertensive, exercise and physical activity. There's a recommendation that you should do at least 150 minutes a week of active exercise. I will describe it as exercise where whatever it is you're doing, you cannot have a conversation with someone else because you are panting. 150 minutes. So that might translate to about 30 minutes, 5 days a week of you walking very fast. There, we are lucky we have a lot of hills. So walking up that hill fast enough that you cannot talk to the person you're walking with. 150 minutes a week. The other thing are the dietary changes that we need to institute. One of the things that Liz has talked about is salt. You are supposed to reduce your salt intake. We do not want you to take 0, but we want to take you very little. About 2 grams per day. So maybe that small teaspoon per day, that is in all your meals, counting the fact that things that you buy from shops, things that are pre-made and processed, might have a lot of salt. So you want to avoid processed things and cook your own meals and then put very little salt in them. We do not want you to take bland food without salt, but we want you to take less salt. For hypertension specifically, diet rich in fruits and vegetables. They are rich in things such as potassium, and potassium is a good chemical, a good salt in terms of controlling your blood pressure. Then we want you to have only the healthy fats, so not the saturated fats that we find in cow meat, and a lot of I've seen there are a lot of pork places in Othaya, so that is all saturated fats. To take low cholesterol oils that we describe as the liquid oils, usually what we use for cooking, and basically a lot of vegetables also. So fruits and vegetables, healthy fats, low salt, and adequate exercise, as we've described, is important in the management of hypertension. Then now we come to medical management, which is what you get in your health facility. And as I described before, there are very many classes of medication, and they are suited to the individual. For example, there are those that are better for the elderly and not so good for the young people. For our men, I think I'd like to address this. Just like in church and everywhere else, we have less men coming to the whole facility to seek care. They should be encouraged to come more. One of the reasons I'd like to mention, sometimes they develop erectile dysfunction on some of the medication we give them. You bring that as a side effect, we change your medication to something else that is more palatable. So there are very many classes of medication, and we'll give them to our patients and prescribe them based on their risk profile, based on their whether they're male or female, their level of activity. So then they take that for lifelong, unless a dose adjustment or a change of medication is required.
Thank you so much.
And like I'd mentioned, I think you have to be followed up, because there are things we do when we follow you up. We check your kidneys, we check your cholesterol, we check your heart, we check your eyes at least once a year, and your blood sugar. Yes.
And I think people don't need to come to the hospital only when they are sick. Sometimes it is good for them to come in for regular checkups, because I feel like when it comes to hypertension, you might not sit at home and feel like, today I'm sick, I need to go to the hospital, yet you're living with this disease with you.
True, I think that's a very good statement to put out there. People need to develop the habit of a regular check. Finances become a problem, but you notice people with finances do it yearly, and things are caught early. And especially with NHIF, there's nothing against coming when you're not feeling bad to the hospital, just to have regular checks. Other thing is that we live in an environment where there is a very good spirit of community, and so there are churches that are always doing blood pressure drives. There are medical camps like we did on Friday. There is always someone doing a blood pressure somewhere for one reason or another. And provided the blood pressure is being done properly, we would encourage you, it's good to be curious, have it checked, and then you know what it is. And we've told you what the normal values are. And then if you're curious, mine is always above 140/90, then you can come and we are able to make a plan about how we need to manage that. So it's important to be curious and to participate in these drives that are free and are available everywhere that we are at. I think you'll allow me some leeway to just talk about, I mentioned a properly done blood pressure, so that's very important. We have an obesity problem, so we know most of our ladies, especially, the blood pressure cuff is not fitting the arm. So that becomes not a good blood pressure. So a properly done blood pressure should be a blood pressure that is done when you're resting, maybe after you rest for 3 to 5 minutes in a place where there is no noise, and your back is to the chair, so you're rested, totally rested, you're not sitting up. And then ideally the machine should be at the same level as your heart. So your arm is placed at a surface that brings your arm to the same level as your heart, your mid-arm, which is where you're taking the blood pressure. Then when the blood pressure machine is at the same level, is at the level of your arm is at the level of your heart, that is a good blood pressure, and the cuff is appropriate. So the cuff is supposed to be able to go round and a half at least of your arm, so that you don't have that one that the health worker is trying to really hold together to read the BP. That would be an inaccurate blood pressure, and that will call just for you to go to another facility which has a better cuff, not to just abandon. Yes.
Thank you so much for that. You're really enlightening all of us here. And yeah, men. All the information that Dr. said applies to you as well. So let's embrace our hospitals and visit them. But I think Madam Lispa here might have a message for men. I'm not saying that that our ladies are not taking tobacco and they're not using alcohol, but I think larger cases are with men. What message do you have for them as you're talking about how to prevent hypertension?
What I can say, it's okay not to be okay. It's okay, you are the man, you are the provider. You can also go down, because maybe most of the men feel like, I'm the man of the house, I'm not supposed to be. You see that ego that is associated with men. It's okay not to be okay, hypertension wise, mental health wise. So let us, what I'll say, it's about self-care. Let us have some self-care. And self-care starts with going for those screening services. Like us ladies, you go, you do your makeup, your nails. Maybe for a man, you just go for a kinyozi, just like the way you go for your kinyozi. I used to say that or the way you take your car for a service. Take your body for a service, and the service is you are the man of the house, you are the one who is paying the NHIF, the insurance packages. So make use of that. It's not just for your family. Make use of the insurance packages. Even men, we have maybe they have an easier access. It's only that they don't see them. They are the ones who are in towns. We have our community health promoters at maybe bus stages. They are just near the town where there are health facilities, just checking there. You know, the problem with men is because they don't want those lines, those queues in the facilities.
They're rushing somewhere to make money.
Exactly. So let us, our men, just 1 hour, go for your checkups, embrace the screening services, the outreaches that are brought at our community level. And also, to echo what Daktari has said, we have a very supportive community, and also we have our CHPs. They are formerly we used to refer them as community health volunteers. Nowadays we call community health promoters, and they have those kits. They have diabetes kits, they have hypertension, they have been trained. So it's all about us to make use of them. Let us make use of them. If at all maybe a man is avoiding to go to like Odaya level 4 because of the queue, let us use those dispensaries at our homestead. Odaya is very blessed. We have about 22 rural facilities, and let us make use of them. As you head to work, make sure you use that dispensary that is just there. That dispensary, you say, I usually go, I don't get medication, go get screened. The screening services are there. So let us embrace those screening services. The system of health, we are trying to shift from the curative to the preventive. So as we change as the healthcare sector, let us, even the community, change. The men, the male, the females, all of us, let us change that. Let us embrace the screening services. Either you go yourself, or maybe make use of the outreaches that are being brought at our community level. Yeah.
Thank you so much for that. And hypertension, just like any other disease or condition out there, might take a toll on one's mental health. At our hospitals, also addressing the mental part of it, that this person could be affected mentally just by the virtue that they have to take drugs every other time.
Yeah, I think at the point of diagnosis, there is a lot of effort being made to help our patients to come to terms with the diagnosis. We acknowledge and accept that when you're told you have a disease that is, you're going to take medicine for the rest of your life and you could get complications, then there's a lot of mental anguish that comes from that. And so in our facilities, we have the nurses who are specialized in psychology, who take the patients through the process of accepting that the diagnosis is what it is, and when they take medication, they're actually taking control of their life, not losing control of their life, and they're preventing eventualities such as the complications. So that is available, and we allow a lot for at least the new patients to ask as many questions as they can about the condition, and sometimes we even give them time to go process and come back, then we start medication, because we really do not advocate for pushing them into medication when they are not mentally ready. So we have those conversations with them. If they're not having an emergency situation, then we allow them to process the news and then start the medication. I'd like to also add something about prevention. We also acknowledge, and it comes to mental health still, we acknowledge that, like she said, Lisbeth said, behavior change is difficult. One of the things I found to be very difficult to quit is smoking. And it's easy to tell them sometimes to just quit smoking, but it should be in a programmed way, with the patients being counseled first of all, and then they start the process of quitting. We have those services where people who are struggling with especially quitting smoking, they can talk to us, because apart from being prepared mentally, then there needs to be the process of how do you actually stop. Is that you're dropping the sticks? Do you need supplements of nicotine, like the patches and the gums, to help with the quitting process? And usually sometimes there are other underlying issues. People say, I only smoke when I'm stressed. So dealing with those stresses is the key to quitting the smoking. I cannot overemphasize the alcohol epidemic in central Kenya and even in Odhaya. We're having a lot of that, and it should be programmed so that even our relatives in the home, especially for alcoholism, it's been considered a disease the world over. So these people are not pretending when they refuse to quit alcohol. They just can't, because it's a disease. So it's important that we enroll them in programs that will allow them to have a programmed way of quitting or stopping the bad habits that then lead to some of these conditions. The other thing I'd like to talk about is maybe the other factors that are new as causatives of hypertension. So for a long time we've had patients saying mine has been brought by stress. So stress is a cause of hypertension, and we talk about chronic stress. Chronic stress is a cause of hypertension, and how it does that is that you release something called stress hormones, and if your stress hormones are constantly elevated, then they'll cause you to have a high blood pressure. So stress, just normal mental stress, work stress, but also other things such as noise pollution and air pollution. So people have been found who live in places that have a lot of noise pollution or air pollution are at risk of developing hypertension. So that those might be less talked about, but they are risk factors for developing hypertension. So chronic stress should really be managed, and even from a mental health standpoint, chronic stress should be managed as a way of preventing hypertension. Yeah.
Now you've raised a very I don't know, something that almost everyone is going through, stress, and I'm just wondering, how much is chronic stress? Because most of us are stressed. Like almost every other day someone is stressed. How much is chronic stress?
So chronic stress, there is no specific amount of time that we describe as chronic stress. But the stress that you have right now should be managed so that it doesn't become chronic stress, because we don't know how long you're going to be in that situation to make it chronic stress. So there are many ways of managing stress. And as we have more highlight on mental health, one of the aspects is to be able to continually, because stress is a factor of life. Nobody will live without stress, but to continually be able to be in a space where you have learned how to separate issues, things that you can deal with, things that are affecting you that you can sort, things you cannot solve, things that someone else needs to solve. So a lot of times you'll stress on the things someone else should solve and the ones you can't solve. And that should not be the case. So it's important to see, and for organizations even like this, to bring in a mental health expert to teach us how to separate the two, and separate them even in your mind, where I'm not going to necessarily dwell on what things I cannot change. I can escalate them to someone else who can change them. Then these ones that are in my purview, those I'll change. There are other things that have been described in studies, including the breathing exercises, where you have someone who comes into your space and suddenly you just feel your heart rate going, and those things are happening all the time. And so you've seen even in guidelines something like breathing exercises. They may sound trivial, but they work. The counting exercises, counting 1 to 10 and monitoring your breathing, those things help to work. The other thing is, debriefing. When something difficult happens or something stressful happens, then to go through it and say, I got reprimanded at work because this happened. What part did I play? How can I change the part that I played? So that you conclude that story in your brain, so that it doesn't keep bothering you. But then if it's not concluded, you do not know that it's affecting you, but subconsciously it is. So to have issues concluded that need to be concluded is also one of the tactics. But it's important that people, especially in an organized setup, in churches, any organized group, should really have those people who can talk to them about the skills to cope and to not hold on to things that lead to chronic stress. Yeah.
Thank you so much for the insights. We really appreciate all that. Now, Lispa, we are looking at this. We've come all the way from the causes, the risk factors, talked about medication, complications that could come from all of these, and not forgetting that cases of hypertension are so rampant in our country. What is the government doing, either to slow down these cases or to prevent? Because like you said, we are taking a preventive angle. What can be prevented? We want to prevent it.
Sure.
How much is the government doing?
So I would like to narrow down to what is happening within Nyeri. So we have the clinics. We have the clinics for now the non-diabetics and the non-hypertensives. Like in our health facilities, in the PGH, where they are reviewed by physicians, we have Udaya level 4. In all the level 4s in the county, we have the clinics. Also, we have narrowed down because you can see, like, you can telling somebody to come all the way from Wetima sometimes to Udaya level 4, it's somehow a bit tricky. So even in our health centers, we also conduct clinics. We also have the partners who are partnering with us with the same, to avoid now the complications. Like on Friday, we had the CTI, who have also been going to various health facilities and mostly they go to the health centers, the dispensaries with those clinics, because we even have the dispensaries with high workloads, and they also conduct clinics. So the CTI go there, they screen as the patients are being seen by the physicians or maybe the specialized clinical officers. We have now the CTI on board. They check for the eye complications, and they have been having a good program in Nyeri County whereby they identify people with cataract and also perform free cataract surgery at their health facility, which is located at Nyeri Town, just somewhere near PGH Hospital. So we have been having that program. We also have a partner called Medtronics Lab, who have been supporting the county. Currently, they are in 11 health facilities. With them, we'll be able to come up with a database of the non-hypertensives, those who come to the clinics, those who are defaulting. So with such a process, now currently they are in 11 facilities, and with time, I'm very sure they will be able to go to the entire health facilities in Nyeri, so that we'll be able now to have a complete database of those people who are hypertensive when they come to the clinic, and also will be able to do follow-up, because now we find that maybe they have a system known as SPICE. Once they are registered, they will be able, now the physicians or maybe the clinician will be handling the patients through the system. We are going in a way that we are calling it the digital superhighway in all government services, and health is also a service. So with the integration of internet, the digitization of health services, we'll be able to first to come up with a database, and also something that will be able to help us to do follow-up of those coming into clinics and those who are not coming for the clinics. The other strategy that we have been using is now the embracing of our CHPs. The CHPs have gone through various health education messages. They have also been trained on how to capture the BPs, on how to measure the sugars, that is for diabetes. So we also have a linkage with them. Once a health facility identifies this is a defaulter, or maybe somebody who is not able to access the health facility, once one is diagnosed, they link them. We have our health facilities, each and every health facility is linked to a community unit. A community unit is comprised of 10 CHPs. Those community levels, at the community level, that is the first level of health. We go to the dispensaries, then to the other tiers of health. So once maybe a facility identify we have an issue with this client, maybe the client is aged, they don't have the access to the health facility, so they task the CHP to be going and giving to and read the measures of the BP and maybe the sugars and record. So by the time that CHP or maybe the client is going to the health facility for a clinic, they already have seen, instead of maybe telling the client to be coming daily, there is that linkage. Also the CHPs, they will also assistance in the first identification of in the diagnosis. They might not maybe diagnose immediately, but once they go to the homestead during their home visits, they'll be able to identify maybe this person, I have measured him or her for the first time, it was high, the next time I came it was high, but there is a problem with that because that CHP went home. So before, like we said, behavior change is a process. So before I conceptualize, now I'm seeing Mama Njeri is telling me I have high BP. This is somebody, maybe we dropped out of school together. So there is that thing with the community. So I would add the community. These CHPs, they are trained. They have gone through several training. They have been equipped. They have the BP machines are accurate. So let us embrace them so that we may be able to reach that goal of shifting our focus from the curative side to the preventive sides. And the CHPs, they are the key focal persons for that because they are our gatekeepers at the community level. So once a CHP comes and visits you twice or thrice and refers you to a health facility, you just go there. The doctor will now take up that. So that is what the CHPs are doing. The equipping of them is ongoing. When they have maybe the strips are over, the batteries are over, they are able to be re-equipped. And also nowadays they are using, if there had been an issue area whereby you find that maybe the CHPs do not have the batteries, the current kit that they have, it is using electricity. And you find that maybe in Nyeri, maybe just few homesteads don't use the electricity. So you find that maybe for that cases, they also have some backup batteries. But currently they are well equipped. They have the kits. We have shifted from it has been a journey. Initially the CHPs only had one kit, maybe with the one BP machine per unit, but currently each and every one of them has a kit. So it's good also, let us use those CHPs either for follow-up, either for maybe now the normal screening. So that is what they have been doing. We have also maybe be having other partners such as AMREF, who have been assisting in now the health education, in the training of the CHPs, and also conducting of outreaches like the one we had last Friday. They have been of great help in Nyeri County at community level. Yeah.
Thank you so much. Now, the government is doing quite a lot, and let's start by embracing the CHPs, and also the medical professionals right here are doing enough to help you curb hypertension. But when was the last time ulipan such that you could not even say hi to the next person? So all I'm saying, let us all play our parts in order to keep it at bay, and when it comes to it, let us manage.
So I think we've had a great discussion. I hope our listeners have gained something from this discussion. I'd like to say that hypertension, which is a cause of cardiovascular disease, is taking people away from us at the prime of their youth, so at the prime of their life. So we'll have people with cardiovascular diseases in our wards in their 50s and their 40s. Those are our parents who are at the peak of their life, at the most productive time in their life, because most of the time we start a bit late. So those are the people that we are losing to these cardiovascular diseases. So there's a real economic impact that we see with these cardiovascular diseases. When we have people being incapacitated or made disabled because of strokes and requiring constant attention because they've had a heart issue because of hypertension, because these are things that we can prevent, we should make every effort to prevent them. And we prevent the onset of the disease. And even when you do have the condition, it's important that we remain well controlled, so that control allows us to live our normal long life without having it being interrupted by these cardiovascular diseases. That's what I'd like to be my parting shot.
Thank you so much. You have a parting shot for your viewers?
Mine is to urge the society, the family members, let us support the hypertensives, the diabetics. Let us, first of all, let us accept it's a disease that has come in our family, and let us now take up that journey. That parent raised you, wacha tuache kuwaacha. Let us go back to the villages, nurture our aged, and also maybe the entire community. Let us talk, let us have those talks at the community level. Let us not shy off from having those conversations. And also maybe for the alcoholics, those people with mental health, they just need a little more love. For somebody to change, for somebody to say, now I've accepted to go to the rehab, because most of the time we just stigmatize them. This is alcoholic, my brother is alcoholic, you just leave them. They stay alone maybe sometimes. So those people, they just need a little more love and they will change. Yeah.
Thank you so much. So it can be prevented, and even if you have it, it can be controlled. Just with a little love, you're going to make our community a better place and able to fight all these conditions. So this has been Medicamp. My name is Mumbi Mavuti. Until next Tuesday, keep it GTN TV, the home of gifts and talents. But then again, remember that we are really counting on your vote to take home the award of TV Station of the Year at Kuza Awards that we have been nominated. To vote for us, go to www.kuzaawards.co.ke and cast your vote there. Alternatively, you can send the word Kuza to 15601 and support us. Thank you so much for being our fan. Remember that your health is your wealth, and keep it GTN TV.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahich Hotel, Murang'a Town, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Robogo Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakima Modern House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725815641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku.
The Nyeri County Annual Tourism and Cultural Festival 2024, initially slated for 17th to 18th May 2024, has been postponed to 21st and 22nd June 2024 due to the heightened persistent rains accompanied by floods being witnessed in the region. We sincerely apologize for any inconvenience caused and assure you that all necessary arrangements are being made to facilitate a seamless transition to the new dates. For more information, contact the Director, Tourism and Culture, Mary Kimamo, on 0722233420 or email us on nyericountytrade@gmail.com. Thank you for your continued